capacity building, and improve cancer care delivery in the FCT. The theme of this convergence, promoting awareness against cancer and advocacy programs in African member states of OIC, underscores the importance of collaborative action in raising awareness, enhancing prevention strategies, and improving access to quality healthcare for those affected by this formidable adversary. Your Excellencies, in the face of such a complex challenge, it is imperative that we unite our strengths, share our experiences, and harness the power of collective action to drive meaningful change across our respective nations. By leveraging the platform provided by the OIC and drawing upon the rich diversity of perspectives represented here today, we can develop innovative solutions tailored to our unique needs and circumstances. Furthermore, as leaders and advocates, we are morally obligated to ensure that no one is left behind in our efforts to combat cancer. As mothers of nations, your role in this fight cannot be overstated. Permit me at this point to sincerely commend our dear First Lady, Her Excellency, Senator Oluremi Tinubu, and the Organization for Islamic Cooperation for their visionary leadership in convening this timely seminar, and I express my sincere gratitude to all participants for their dedication to this noble cause. We hope that this convergence will provide an avenue for knowledge sharing and experiences in the fight against cancer. We also look forward to your insight and guidance as we jointly combat this dreadful disease. Once more, I welcome you all to this seminar and wish you a memorable stay in our beautiful city of Abuja. Thank you for your valued attention, and may God bless our collective aspirations.
Thank you very much. In the spirit of harnessing the power of collective responsibility, I move to goodwill messages and invite the representative of WHO in Nigeria, Dr. Walter Colombo, to kick off the goodwill message. Can we please put our hands together for him as he marches to the microphone?
Your Excellency, Senator Oluremi Tinubu, First Lady of the Federal Republic of Nigeria, the mother of our nation, Your Excellencies, First Ladies, distinguished guests and invitees, please permit me to abide by existing protocol. Let me use this opportunity to bring to you the warm greetings of Dr. Tedros, our Director General, and Dr. Moeti, our Regional Director for WHO Afro, who would have loved to be here with us, but couldn't make it. Let me also take this opportunity to congratulate Her Excellency Senator Oluremi Tinubu for hosting this symposium of 17 OIC countries. My appreciation goes also to other First Ladies in the OIC for the significant progress being made to ensure cancer awareness and advocacy is a priority for Africa. I would like to thank the OIC Secretariat for inviting WHO this goodwill message. And I would like to take this opportunity to highlight a few facts which buttress the importance of this event today. The WHO African region accounts for a significant proportion of global burden of cancers, and the region accounts for about 6% of the global burden of cancer cases and 7% of cancer death. About half of new cancer cases are in approximately 1 million new cancer cases occur in the African region. In that same year, the WHO African region recorded almost half of deaths from cancer. If urgent measures are not taken, cancer mortality in the region is projected to reach about 1 million deaths per year by 2030. Cancer is not just an adult disease, as we realize. Children are also afflicted, with about 400,000 children developing childhood cancers globally every year. And in 2022 alone, approximately 50,000 new cases were reported in this region. And most of these childhood cancers in the region are leukemia, non-Hodgkin lymphoma, and kidney cancer. So in general, cancer survival in the region are abysmal and are driven by late detection and limited availability of screening services. But I would like to emphasize also that despite the dire cancer situation in our region, progress has been made, with 17 countries having introduced high-performance-based screening tests in line with WHO recommendation, and Nigeria is one of them. Also, 28 of our member states have introduced nationwide human papillomavirus vaccination to reach about 60% of the priority population targeted for HPV vaccination. And I'm glad to count again Nigeria among those who are introducing HPV. We at the World Health Organization have in recent years launched key 3 global initiatives to fast-track the elimination of cervical cancer, to improve survival rate of childhood cancer, and to reduce breast cancer mortality. The global initiative for childhood cancer aims to raise the survival rate to at least 60% globally, a laudable doubling of the African survival rate if achieved. To add this potential, we do recommend that countries seize this opportunity to mainstream and integrate intervention for children with cancer into broad packages of health services. More needs to be done to advance this agenda and reach effective control of cancers in WHO African region. We need a multi-sectoral approach, and Your Excellencies, First Ladies of the OIC member state, you have an onerous task of advancing action toward mainstreaming country action for control of cancer and NCDs in Africa. Today, I would like to call on OIC countries and the region at large, communities and partners, civil society, to unite and foster universal access to cancer. As you deliberate at this important meeting, it's vital for stakeholders to identify feasible priorities, implement evidence-based population-wide intervention, and invest in cancer control. I urge countries to use the updated WHO best buys, the facilitative tool designed to enable government to select life-saving policies and intervention for NCDs. Further, I would like Your Excellencies to note persistent gender bias in access to cancer care services. First Ladies can be strong advocates for social, legal, and gender rights interventions needed to disrupt gender norm and discrimination at system and institutional level. The First Ladies must equally advocate with our leaders to see the need for deployment of cancer prevention and care technology and therapies that are available at low cost to affected persons and their families, and which are value for money. Furthermore, countries should strengthen information system to gather quality for decision making. Your Excellency, the First Lady, when you launched the We Are Equal campaign, I was pleased to hear the head of state saying, I'm available anytime you need me. So we want to use this opportunity to also advocate for cancer control. The fight against cancer in Africa. And yesterday, I was following testimonies for some of them, it was very moving situation. We need definitely a whole of society approach to cancer prevention and care, which is key to us to win the fight against cancer. It's possible. And I know the impossible is not Nigerian. Nigeria, the big brother, should drive this effort, which will, in the end, benefit the whole of Africa and the globe as a whole. On this note, I wish you productive deliberation and look forward to strengthening our collaboration in taking forward the decision that Your Excellencies might agree upon at this particular conference. Thank you again for your attention.
Thank you very much. And knowing that we all have a role to play. Your Excellencies, all very distinguished ladies and gentlemen, I'd like now to invite the Director General of the International Atomic Energy Agency, Dr. Rafael Mariano Grossi, to address us.
Good morning, everybody. Dear First Lady, Senator, dear First Ladies here present, dear friends, colleagues from international organizations. Maybe, just maybe, some of you may be wondering what is the head of the International Atomic Energy Agency doing in a meeting that is devoted to the problem of cancer. The IAEA is sometimes goals, including cancer and radiotherapy. Of course, radiotherapy is nuclear medicine, is oncology. And of course, radiotherapy is necessary treatment in about half of the cancer cases that we have all over the world. The IAEA, and I was pleased to see just preceding me here at the podium, the representative of the WHO for many, many decades. And I personally cherish the joint collaboration I have with Dr. Tedros, with whom the IAEA launched a little bit more than a couple of years ago a program called Rays of Hope. Rays of Hope is about these rays of radiotherapy that are necessary and essential, indispensable to save lives. My distinguished colleague was just now giving some sobering figures, which we must understand and we must weigh when we decide our policies, internationally and nationally. What he said means that every day 2,000 Africans die of cancer. Every day in this continent. It means also that around 80% of Africans do not have any access to radiotherapy, any at all. First Lady, in Nigeria you do have radiotherapy, perhaps not as much as you would need, and we are working with you, with the Minister of Health. I was visiting yesterday the National Hospital, which we have been assisting for many years, and we are going to continue that. And we are doing that in most of the countries here present. But the situation indeed is very, very serious. And we have to, at a time where we are dealing with a number of crises, energy crisis, wars, etc., there is this secret weapon that is killing us by the millions. Non-communicable disease, among those cancer. The IAEA is not about policy. The IAEA is about concrete projects. It's about giving you the technology. It's about training your doctors, your oncologists, your radiotherapists, so that they are able to provide these services to your people. And this is what we are going to be doing. Rays of Hope, this project that we launched a couple of years ago, has already 80 countries requesting assistance. Many of them members of the Organization of Islamic Cooperation, and about half of them African countries, which is in itself a reflection of the seriousness, the gravity of the issue that we have in front of us. But the most compelling, I would say, the most compelling argument that we should be looking at is the fact that in this continent, people are dying of perfectly curable cancers. Where I work in Vienna, almost no one, no woman, almost, statistically speaking, dies of breast cancer. In Africa, this may be a death certificate. And this is something that it is within our reach. We have the technology to be radiotherapy unit in a capacity to have access to radiopharmaceuticals, to radioisotopes, so that we can cure people. So the IAEA is a partner. We are ready to be doing this. And I want to praise the First Ladies that have the unique view of what is happening to their peoples to help us in this regard. What we need is alliances like this. And I'm happy to note that the Islamic Development Bank is here with us. I'm talking to development banks all over the world and to international finance institutions, because as I said, it is a matter of pulling our efforts together. The situation around cancer can change dramatically. It is in our hands. It is within our reach. And you can count on the IAEA to join with you in this effort. I thank you very much.
Thank you very much. I think the crux of the matter there is that there are some cancers that are curable if they are detected very early. Thank you that the cooperation between advocates and others on cancer will continue to enjoy the support of IAEA. We'll move next. Our next speaker is the president of the Islamic Development Bank, or the representative. Well, we are at this moment going to listen to an address that will say to us that the present administration has placed cancer as a priority, with the hope that we will have very soon all the geopolitical zones in Nigeria will have a cancer center. And we also have a special department and commission, the NICRAT, that will continue to lead this. Without preempting the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, I'd like him to complete or ensure that what I've said about the administration is not just on paper, but a reality. Honorable Minister, sir.
Yeah, thank you, Auntie Moji. What you said is just not on paper. We're already seeing actions, and our country, our citizens are benefiting already. Yes, we need to give a big round of applause to our president for that, please. Let me begin by acknowledging our First Lady, our mother, the matriarch of our nation, distinguished Senator Oluremi Tinubu. We can't thank you enough. We in the health sector, every time we've come to you for you to champion our cause, to champion the cause of the country. Every time you've said yes to us. Thank you. Just in the last 6 months alone, you've championed 4 big initiatives that we've undertaken in the Ministry of Health and the Health sector. You accepted to be champion to stop blindness in the country when we launched Jigibola 2.0 just about 6 months ago. We came to you again on our vaccination efforts with the human papilloma vaccination. You decided to take that leading role. This vaccination effort was phenomenally successful, largely because of your advocacy. Just about 2 months ago, you also took the role of being the national and global Stop TB advocacy. Thank you so much for that. Today, you're leading the fight against the scourge of cancer, both in Nigeria and in the entire Africa, by hosting this, agreeing to host this conference. Please, let's give her a big round of applause. As well as Her Excellency, Mrs. Fatima Madobio, the First Lady of Sierra Leone. Thank you for coming. And Her Excellency, Mrs. Fatimata Barrow, we appreciate your presence and your support of our First Lady. Thank you for being here. The Speaker of the House of Representatives, Right Honorable Tajuni Abbas, thank you, as well as other members of the National Assembly that are here today. Wives of the National Assembly members that are here, the wives of our executive governors that are here today, thank you for the support. My fellow colleagues, honorable ministers that are here today, and more importantly, the West African ECOWAS Community Minister for Health for joining us today. Tomorrow we'll be having a West African Minister for Health Council meeting, and thanks for accepting to come and join us today. Thank you. We welcome you to Nigeria. I would also like to acknowledge our First Lady against cancer, led by Ajia Zainab Shikamfi Bagudu. We thank you for all the work you're doing in our country to fight and end cancer. Thank you so much. Please let's give them a round of applause. The representative of the Organization of Islamic Cooperative, Dr. Ahmed Segendo, DG Grossi of International Atomic Energy Agency, thank you for all the work. You and I visited the National Hospital. Acknowledge all traditional leaders that are present, and the permanent secretary present here, especially amiable permanent secretary of Ministry of Health, Ms. Daju Kacholon. Thank you for all your support. All the agency head, our development partners, all international local delegates that are here today, members of the press, distinguished ladies and gentlemen. Today is a very remarkable day in a fight against cancer in Nigeria and the entire Africa. We are delighted because the President of the Federal Republic of Nigeria, His Excellency President Bola Ahmed Tinubu, has taken the driver's seat in the fight against cancer and other killer diseases in Nigeria. We're also pleased with the encouragement by Lady, Excellency, Distinguished Senator Oluremi Tinubu, who has assumed the role of a co-pilot in the fight against cancer alongside with our president. Permit me to place on record that in the first year of the administration of President Bola Ahmed Tinubu, the health sector has received more attention than it has ever received in the last 2 decades. Mr. President's commitment stemmed from his renewed hope agenda, which has witnessed unprecedented success in various sectors of the economy, including the health sector. President Bola Ahmed Tinubu's particular interest in cancer care was sequel to bringing to his attention the negative statistic of cancer that we have in our country since 1960. And these bad indicators have never been reversed by our previous successive government. I want to remind us that the global distribution of predominant cancers continue to change, especially in developing countries. Low and middle income countries accounted for 51% of all cancers worldwide in 1975. The proportion increased to 55% in the year 2007, 70% in the year 2018. The rise in the incidence of cancer is even worse with breast cancer, cervical cancer, prostate cancer, colorectal cancer, and lymphomas, which have remained the top 5 common cancers in Nigeria for a long time, and now the incidence of these cancers are continuing to rise. Reports from the Nigerian National System for Cancer Registry show that breast cancer incidence in Nigeria increased significantly between the year 1960 and 1969 from 14 cases per 100,000 population to 26 cases per 100,000 population by the year 2000 to 2016. The most recent estimate in 2022 still show that breast cancer still leads with an incidence of 26%, prostate cancer with an incidence of 15%, and cervical cancer with an incidence of about 10%. Why cervical cancer remains the second commonest among women, its reduction in overall incidence can be largely attributed to the Federal Ministry of Health intervention, as this is the only cancer that we've given dedicated plan of action to eradicate in our country. Our intention to eliminate cancer of the cervix is because, among other things, it is preventable and curable, especially when detected early. On this note again, I want to commend Our Excellency Senator Oluremi Tinubu for launching the human papillomavirus vaccine last year for the prevention of cancer of cervix. Our Excellency intervention has made a difference as it contributed largely to the acceptance of this vaccine, despite some resistance in few places. In order to completely address the challenges of cancer care in our country, the current leadership of the Federal Ministry of Health and Social Welfare is leaving no stone unturned. This is the reason why we are in a hurry to ensure the entire cancer continuum is given all the necessary priority attention. This includes cancer prevention, treatment, supply chain management, hospice and palliative care, advocacy, and social mobilization, data management, research, as well as governance and finance. These priorities of actions of cancer control are all adequately addressed in a 4-pillar agenda at the Ministry of Health, which include improving health governance, improving our population health outcomes, unlocking our healthcare value chain, and seeing health not just as physical security, but as part of our national security and social security as well. Our Excellency intention to link the cancer prevention and early detection approach is a very welcome development. This is demonstrated by our acceptance to host this third edition of the high-level regional seminar seminar of the Organization of Islamic Cooperation State on promoting cancer awareness and advocacy program in the OIC African member states. The acceptance of the First Ladies of this forum to serve as champion in these various countries is a worthy commendation. There are no better individuals or group that can do this job like the First Ladies. Thank you. We appreciate the similar activities of the wives of our governor under the auspices of the First Ladies Against Cancer, who have made remarkable impact in their various states. I want to appreciate you all and encourage you to be steadfast and maintain the tempo that you have already established in your individual states. Your Excellencies, distinguished colleague, I want to firmly pledge the unalloyed commitment of the leadership of the Federal Ministry of Health and Social Welfare to continue to provide all necessary policy directions and platform to sustain the fight against cancer in our country. We're also happy to support our neighboring countries in any area that you may require of us. I want to encourage all stakeholders, especially the non-governmental organizations, to continue to partner with the Ministry of Health in the implementation of our plans, programs, and policies to prevent all preventable cancer and provide prompt treatment to all diagnosed cases while providing necessary support to ensure that all cancer survivors are adequately reintegrated in the society. On this note, distinguished guests, ladies and gentlemen, I want to enjoin all participants to maximize the opportunities provided by this high-level seminar to imbibe new ideas, network, and forge collaboration for better approach to cancer awareness and advocacy for early detection. I thank you for listening. God bless our President, and God bless the Federal Republic of Nigeria. Thank you.
I think he deserves another round of applause. Thank you very much, Honorable Minister of State for Health, Dr. Alausa. We are continuing with this program, and I'd like to thank members of the media, particularly those that are putting this live to ensure that the seriousness of what we are here gathered is beamed to the rest of the world, as it were. Our next speaker is the statement by the OAC Secretary General, ably represented by His Excellency Dr. Ahmed Kewesa Sengendo, Assistant General Secretary for Economic Affairs, Science and Technology. Can we welcome him warmly, please? That's not warm enough if we are fighting cancer.
Bismillahir Rahmanir Rahim. Your Excellency, Senator Olulemi Tinubu, OON, CON, First Lady of the Federal Republic of Nigeria, and our host, Your Excellencies, Highnesses, the First Ladies from other African OIC member states, Right Honorable Dr. Tajuddin Abbas, Speaker of the House of Representatives, Honorable Ministers and members of the National Assembly, Your Excellency Mr. Rafael Marino Gross, Director General of the International Agency of Nuclear Energy, Your Excellencies, ladies and gentlemen, Our Excellencies, members of the Diplomatic Corps, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Allow me at the outset to convey fraternal greetings of His Excellency Hussein Brahim Taha, Secretary General of the Organization of Islamic Cooperation, and his best wishes for a successful and productive seminar. I take this opportunity to express our gratitude to the First Lady, the government and the people of Nigeria for the warm reception and gracious hospitality extended to us since we arrived in this beautiful city of Abuja. I would like to put on record our deep appreciation to His Excellency, Her Excellency Senator Olemi Tinubu, OON, CON, for her patronage in organizing this high-level regional seminar on promoting cancer awareness and advocacy programs for OIC African members. Our special thanks go to Her Excellency, Madame Emina Edogan, for setting a good example by her patronage in organizing the first ever special session of First Lady's leadership on cancer control in OIC member states on the margins of the 13th Islamic Summit held in Istanbul, Turkey on 14th April 2016. I would also like to extend my sincere thanks and appreciation to Your Highnesses and Excellencies for supporting this worthwhile initiative. Your presence is a manifestation for supporting this worthwhile initiative. Your presence is a manifestation of the commitment and resolve of the OIC African member states to provide a healthy future to their people. Excellencies, ladies and gentlemen, today we gather with heavy hearts and determined spirits, united by a cause that touches each and every one of us, the fight against cancer. All of us here today know someone who has cancer, who has survived it, or who became a victim. This should be cause enough for all of us to support this worthy cause. A gathering like this one, where national governments, international partners, and civil society organizations come together to discuss how to tackle this silent killer, is just the beginning of the long overdue dialogue and public awareness campaign to save lives, especially those already affected by the disease. While the number of cancer cases continues to rise at an unacceptably high level, especially in Africa, the overall survival rate is decreasing due to lack of awareness and the failure of some national governments to consider the disease as a national health priority. It is, however, gratifying to note that you are beginning to turn the tide against cancer, as demonstrated by your very presence here today. It is high time we started taking cancer seriously, just as we consider other killer diseases such as AIDS, malaria, and tuberculosis. Our fast-changing lifestyles, rapid urbanization, unhealthy diets, lack of physical activities, and environmental exposures have made all of us susceptible to cancer. Elevating public awareness about cancer, particularly the critical importance of early detection, stands as our primary weapon in this fight. Astonishingly, 1/3 of all the cancer cases is preventable, and 40% of all cancer-related death could be forestalled through early detection. Excellencies, ladies and gentlemen, the current situation demands immediate and coordinated action. According to available statistics, the number of people diagnosed with cancer is expected to rise approximately by 21.4 million, and an estimated 13.2 million of people will die of the disease by 2030. One should also not forget the colossal economic cost of cancer on national economies. The families and individuals affected by cancer have to face unbearable human and economic miseries for decades. More than half of the OIC member states are low and medium income countries. The burden caused by cancer calls for dedicated resources, both financial, human resources, and infrastructure beyond that is available from the national health budgets. In this light, we commend the civil society organizations gathered here from various member states for coming out to complement government efforts in fighting cancer. We also recognize the valuable contributions of international partners such as the World Health Organization and the International Atomic Energy Agency, and the OIC institutions such as the Islamic Development Bank, CESRIC, COMSTEC, for sparing no effort in extending support to our member states in their endeavors to improve the lives of their people. Ladies and gentlemen, the OIC General Secretariat is fully conscious of the centrality of health in achieving the development objectives of the member states. The OIC 2025 Program of Action and OIC Science, Innovation and Technology Agenda 2026 all mandate the OIC General Secretariat to take practical steps for strengthening public health systems of the member states. The adoption of the OIC Strategic Health Program of Action, SHPA, by the fourth session of the Islamic Conference of Health Ministers in 2013 provided a framework for addressing the health-related challenges of member states. Through this program, a lot has been achieved. Successive sessions of the Islamic Commission of Health Ministers took specific note of the growing incidence of cancer in the OIC member states, in particular in Africa, and called for actions to address this trend. Subsequently, the OIC General Secretariat, in collaboration with the Islamic Development Bank and the IAEA, embarked on projects for the strengthening and establishment of cancer treatment facilities in several OIC member states. The OIC General Secretariat signed a practical arrangement agreement with IAEA and Islamic Development Bank to broaden the scope of the ongoing cooperation. We look forward to the extension of the agreement and getting as many member states as possible to benefit from it. Excellencies, ladies and gentlemen, today's event is a milestone in our effort to support national, regional, and international initiatives to address the issue of cancer. Our fight against cancer begins by adopting healthy lifestyles, which in the long run is the most cost-effective method to fight cancer. Your leadership will help in bringing all the stakeholders, including civil society organizations, together to bring about societal and behavioral changes that are required to express the root causes of cancer. Before I end my remarks, let me highlight one important aspect we need to consider in our fight against cancer here in Africa. This is the need to identify, document, and preserve all the available indigenous knowledge and plant species that are used in the traditional treatment of cancer in our countries. The knowledge that our traditional herbalists have needs to be documented before they go to the next world with it. Every bush or forest that is burnt down or cleared for agriculture takes with it many plant species that are of medicinal value. We need a serious program for preserving them by establishing national medicinal botanical gardens or forests so that we can preserve these medicinal plant species before they become extinct. I look forward to your continued patronage to make the public awareness campaign against cancer successful and establishment of a strong national program to tackle cancer in each of our countries. The OIC General Secretariat, on its part, remains committed to provide all assistance to pursue this fight against cancer till the very end. Let me end by once again thanking Her Excellency Senator Olulemi Tinubu, OON, CON, for this initiative, and thank all of you for making time to to grace this important occasion. Thank you for your kind attention.
Again, let's applaud that powerful speech, particularly the one that resonates with the fact that we must keep our botanic free given. We must ensure that our environment accommodates that. Who knows? Maybe that leaf or that herb or that seed might be the answer to curing cancer. Because for now, there is no cure to cancer unless we prevent it. Shall we again applaud him? Well, since we are looking in country to how best to promote the prevention of cancer, our next series of speakers will be giving us their country's experience. But let's just share a little of Nigerian experience and give a round of applause to the First Lady's action against AIDS in Nigeria, against cancer in Nigeria, led by Dr. Zainab Bagudu, who is covered up with the media there, but that is what our First Ladies are doing in Nigeria, advocating for the prevention, treatment, and cure of cancer. A round of applause for them as I move on to invite all the speakers, their excellencies who are here with our First Lady to share at this event. The representative of Her Excellency, the First Lady of Mauritania, who would address us as we listen to experiences from countries. Okay? We'll move on quickly. I'd like to invite, thank you. If you have the headset, you'll go to channel 1 to understand and listen. Yes.
بسم الله الرحمن الرحيم وصلى الله على نبيه الكريم. السيدة الأولى بنيجيريا الاتحادية، السيدات الأول، المدعوون الكرام، كل باسمه وجميل واسمه. بداية أتقدم لكم بتحية السيدة الأولى بالجمهورية الإسلامية الموريتانية الدكتورة مريم محمد فاضل الداه، التي حالت ظروف طارئة دون تمكنها من المشاركة في هذا الملتقى الدولي الهام. كما أشكر جمهورية نيجيريا الاتحادية على حسن الاستقبال وكرم الضيافة التي كنت موضعا لها والوفد المرافق لي. كما أنتهز هذه الفرصة للإشادة بهذه المبادرة الفريدة من نوعها من حيث الموضوع ومن حيث نوعية المشاركين. أيها السادة والسيدات، بودي لو تطرقت للتجربة الموريتانية في مجال المناصرة وعلاج السرطان، حيث اتخذت بلادنا قراراً وطنياً بالاكتفاء الذاتي في مجال الاستجابة لعلاج المرضى الموريتانيين وكذا الوافدين من مرضى السرطان، وأنشأت لهذا الغرض مركزاً وطنياً للإنكولوجيا يقدم خدماته الصحية لجميع المرضى الذين تمثل النساء 53% منهم من بينهم، ومن بين الفئة العمرية الأكثر عرضة للإصابة بهذا المرض التي هي الفئة العمرية بين 40 و60 سنة. ومن أهم أسباب الإصابة بالسرطان في موريتانيا يمكن أن نذكر بالإضافة لقابلية الإصابة بالسرطان عن طريق الوراثة أسباب تتعلق بالنمط الغذائي ومحدودية الكشف المبكر، فضلاً عن التدخين والأمراض الفيروسية والتعرض للأشعة. أيها السادة والسيدات، تلعب السيدة الأولى الدكتورة مريم محمد فاضل الداه أدواراً كبيرة في مجال المناصرة وعلاج السرطان، حيث ترأست أول حملة وطنية شاملة للكشف المبكر عن السرطان وخاصة سرطان الثدي. السرطان الأكثر انتشاراً في بلادنا. كما تم تنظيم العديد من الحملات الوطنية من طرف مختلف الفاعلين في هذا المجال تحت رعايتها السامية. وتقوم الحكومة الموريتانية بالتكفل التام بالمصابين بهذا المرض، وذلك عبر التأمين الصحي أو الضمانة الاجتماعية، فضلاً عن الخدمات شبه المجانية التي يقدمها المركز الوطني للإنكولوجيا. ويستفيد المرضى المعوزون المصابون بالسرطان من تحويلات مالية شهرية تساعدهم على التنقل. وتحظى موريتانيا بمجتمع مدني نشط في مجال المناصرة والتحسيس، وفي بعض الأحيان المساهمة في تحمل بعض نفقات العلاج المرتفعة جدا. أيها السادة والسيدات، أغتنم هذه الفرصة لدعوة دول منظمة التعاون الإسلامي وكذا مختلف الفاعلين الدوليين المشاركين في هذه الندوة الدولية رفيعة المستوى للإطلاع عن قرب على تجربة موريتانيا في هذا المجال، ومد يد العون والمساعدة والشراكة من أجل تحسين الخدمات العلاجية لمرضى السرطان وتحسين آليات التكفل بهم. أجدد لكم الشكر باسم السيدة الأولى الدكتورة مريم محمد فاضل الداه، وأتمنى لأعمالنا التوفيق والسداد، والسلام عليكم ورحمة الله وبركاته.
Next, we're going to call and listen in to Her Excellency from Sierra Leone, Mrs. Fatima Mada Bio. Please, can we welcome her very, very warmly.
Thank you. Hello. Her Excellency, our host, Senator Oluremi Tinubu, OON, CON, the First Lady of the Federal Republic of Nigeria, my dear sister, Her Excellency Mrs. Amina Erdogan, the First Lady of Turkey, my mommy, Her Excellency, my dear sister Fatmata Barbaro, First Lady of the Republic of the Gambia, Mr. Rafael Morano Gorsi, the Director General of the Atomic Energy Agency, the Right Honorable Speaker of the Federal Republic of Nigeria, Tajuddin Abbas, His Excellency Barrister Ezenwo Nyowaki, the Honorable Minister of the Federal Capital Territory of Abuja, the Honorable Minister of State for Health, Dr. Tunji Alausa, heads of delegations, members of the Fourth Estate, a very good morning to you all. First, let me start by congratulating our host, the First Lady of Nigeria, for putting together such a wonderful event and bringing us First Ladies together, and also awakening our awareness on the scourge of cancer in our continent, Africa. I want to say thank you so very much, ma'am, for inviting me and my delegation here today. And I'm very humbled to be part of this. Cancer represents a significant public health challenges in the sub-Saharan Africa, impacting numerous regions across the continent. It stands among the top 3 causes of premature deaths, occurring between 30 and 60 years of age in nearly all of Africa's nations. Globally, projections indicate that both the incidence and mortality rate of cancer will continue to rise in sub-Saharan Africa by 2030 if decisive actions is not taken. While cancer-related fatalities are on the rise in low and medium-income countries, high-income countries have been witnessing a steady decline in both the incidence and mortality rate of this disease. This decline is largely attributed to the presence of robust diagnostic and treatment facilities, adequate human resources, and effective follow-up systems. As a continent, it is imperative that we reverse this alarming trend by intensifying our efforts for the well-being of our people. It is important to recognize that a cancer diagnosis not only impacts the patient, but also profoundly affects families, friends, often becoming a source of considerable emotional distress. In 2020, according to the International Agency for Research on Cancer, Global CAM report, it was estimated that Sierra Leone alone reported 4,708 new cancer cases, with women bearing the disproportionate burden due to the prevalence of breast and cervical cancer. In response to these concerns, in cancer incidents, our government, led by His Excellency retired Brigadier Julius Madabio, embarked on a strategic plan engaging in collaborative efforts with international partners such as the International Atomic Energy Agency, the World Health Organization, Mac Foundation, Gavi, and UNICEF. This initiative focused on capacity building, the development of evidence-based national cancer control policy, and the enactment of the Tobacco and Nicotine Control Act of 2022. Despite this significant impact of cancer on children, current evidence suggests that environmental or exogenous factors play a minor role in pediatric cancer development. However, recognizing the importance of early detection, the Ministry of Health has prioritized efforts to raise awareness and improve detection rates. These efforts include radio and TV awareness programs, sponsored work to drive awareness, and comprehensive training program for healthcare workers at various levels of the healthcare system. Furthermore, in 2022, the government introduced the human papillomavirus vaccination program targeting 153,991 girls aged 10 years in school across the nation. This community-focused intervention aimed to reduce vaccines hesitancies through extensive community engagement activities. Over the years, we have also invested in training healthcare providers and implementing screening programs using advanced technologies such as VIA and thermal ablation, significantly enhancing our capacity for early detection and treatment. The government of Sierra Leone is demonstrating strong political will by spearheading the establishment of a state-of-the-art radiotherapy center. This center will offer optimal treatment options for cancer patients, thereby reducing the need for overseas treatment and easing the burden on affected individuals and their families. We have completed the feasibility studies and infrastructure designs and are now working closely with the IAEA to commence construction of the Cancer Diagnostic Treatment Center that our people will use. At this juncture, allow me to also say from the Office of the First Lady, we have worked with Mac Foundation. We have managed to train about 42 doctors on oncology and the treatment of cancer and palliative care. Through the Office of the First Lady also, we campaign to bring awareness on cancer problems in our country. We help so many cancer patients to travel out to abroad for medical treatment. But our agenda now is to make sure that we have our own medical facility in Sierra Leone where we can treat our people in our own here to bring more awareness. I know we're here to talk about something that is so prevalent and something that Africans don't want to talk about. When you talk about cancer in Africa, we feel like we're talking about something that we should not be discussing, but it is indeed killing our people. It is killing women, it is killing children, and even men. And until and unless we accept the fact that cancer is one of the most dangerous killer disease we have in Africa, and come together and focus on this agenda in bringing the right treatment and the diagnostic centers that we need in Africa, we will be gathering here, and tomorrow we'll go to another African country, and the other time we'll go to an African country and be talking the same language. We need to now take action. Action by Africans, action by ourselves, where we will deal with our problems, a problem that affects our people, and a problem that only us can solve it. And I want to commend again the First Lady of Nigeria for bringing us together, and to congratulate the First Lady of Turkey for joining us African First Ladies. Through this, we know we have support all over the place, and knowing that the IAEA head is here also, we also want you to consider us Africans as partners. We might not have all the wealth in the world, but we also know we contribute to the world's success. As Africans, we have to, together with unwavering commitment and collaboration, we have to fight, and together we can combat this scourge of cancer and ensure a healthy future for our countries, our continent, and a continent that have contributed so much to the success of the world. Thank you very much.
Thank you. So important that indeed we have to look inwards to ensure that not just the prevention, but also cure and treatment is taken care of in country to reduce the cost. Most importantly, we must build capacity, even amongst the medical practitioners themselves, so that we all together, putting our hands together and bringing value to the table of preventing and ensuring that treatment is available in Africa. Thank you, Your Excellency. We're moving on quickly. Would now go to the Republic of Gambia, where I'd like to invite Her Excellency Fatoumata Abba Barrow, who would address us. Thank you very much.
I'm sorry about that. Your Excellencies, my dear sisters, First Ladies, Honorable Ministers, the OIC Assistant General, Secretary General, the OIC Director of Family and Social Affairs, the media, ladies and gentlemen, good morning. Distinguished Senator Oloremi Tinubu and her team for welcoming us home. We look forward to welcoming them to their home in Banjul soon. Excellencies, ladies and gentlemen, non-communicable diseases, NCDs, are the leading cause of death and disability around the world, accounting for more than 70% of global deaths, occurring mostly in low-income countries. The Gambia, like many other countries in Africa and within the OIC, is currently experiencing a double burden of NCDs. In addition to the challenges here, there is a limited national capacity to address and respond to these needs. According to WHO, NCDs accounts for more than 30% of total annual mortality, mainly due to diseases such as cancer. Therefore, it is necessary to explore potential avenues to alleviate the high burden of NCDs in the Gambia, with a special focus on cancer. Sadly, although cancer is more common in the developed world, over 70% of those dying from these diseases are from the third world countries like ours. Additionally, my country suffers from the lack of adequate health infrastructure and shortage of healthcare professionals, which further causes neglect of women and youth in healthcare coverage. This forum on cancer is therefore important to draw our attention to a critical health issue affecting people worldwide. It is important that we raise awareness about this silent and deadly disease, highlight the significance of prevention, early screening, vaccination, and timely treatment by raising awareness. Excellencies, ladies and gentlemen, in my humble opinion, the team promoting cancer awareness and advocacy suggests that increasing needs to prevent the number of cancer-related deaths through awareness. Hence, by focusing on preventive measures, we not only safeguard our health, but also reduce the burden on healthcare systems. Over the years, we have learned that some cancers affecting women, like cervical and breast cancer, are preventable diseases. And through regular screening and early detection, we can diagnose abnormalities before they progress to cancer. Encouraging vaccination in both young girls and boys is a proactive step towards eradicating HPV, a leading cause of cancer, cervical cancer. Let us therefore prioritize vaccination to protect future generations from the devastating impact of this disease. Equally important is the need for a timely treatment if diagnosed with cancer. Seeking early treatment significantly improves the chances of successful outcomes. By addressing this burden promptly, we not only save lives, but also reduce the strain on healthcare resources. In the Gambia, we realize that an effective way of possible reduce of death as a result of cancer is to build a cancer healthcare capacity in addition to speaking up against it, to raise awareness. Educating people about cancer is essential in changing lives, especially among the vulnerable groups of society. As such, I am a strong advocate for the fight against cancer and work with many local stakeholders to raise awareness about the issue, particularly breast and cervical cancer, which affects Gambian women. As most cancer patients often seek help too late, and when the disease is already at an advanced stage, my efforts in the fight against cancer, including advocacy programs, screening sections, training of healthcare professionals in oncology, which the support of Mark Foundation, we have trained over 80 doctors. Thank you. I provided a mammogram machine to the country, main referral hospital, and ensuring that medical camps are held on a regular basis with the support of partners. Each year, we commemorate Cancer Awareness Month in interacting manners with different communities and associations to ensure that the importance of getting screened and seeking treatment is put across as many Gambians as possible at local hospitals and other public spaces. I also partake in video messages, immunization campaigns, screening sections in hospital, work for health to not just tackle these terrible diseases, but to also serve as an example to all Gambians, and hopefully spread the underlying message that a healthy nation leads to a productive nation. A special project that we are currently working on with the partners including Rays of Hope Foundation of the International Atomic Energy Agency, IAEA, amongst others, is to establish the first ever cancer center in the Gambia. I also have the pleasure, thank you, I also have the pleasure of receiving Commonwealth guiding framework on behalf of the Gambia last year, which shall further guide us to our national response to address rising burden of NCDs in the country with the focus on cancer. In the Gambia government continues to make efforts in addressing NCDs and recently launched an NCD strategy and envision a country free from avoidable burden and non-communicable diseases such as cancer. As per the World Health Organization recommendation, we have a National Cancer Registry and have recently revived the National Cancer Committee to enhance efforts in our national fight against cancer. Excellencies, ladies and gentlemen, I would like to assure you of my commitment to work with youth, women, and communities to join efforts in our collective resolve to reduce the numbers of cancer-related deaths through advocacy. I wish to seize this opportunity to call upon all of my sister First Ladies of the OIC, the Secretary General, and all partners here present to work together and form a solid partnership that transcends borders to amplify access to healthcare. Let us unite in the mission to raise general healthcare awareness. Together we can do it. I thank you all.
Thank you, Your Excellency. Together, we would walk the walk. Together, we would ensure that we eliminate, as it were, cancer in our various countries. Thank you very much. We are moving on outside the continent. The mother of the nation has also invited a woman who has given her a good reception at the time she visited. And she's here today as our guest, Her Excellency, the wife and the First Lady of the Republic of Turkey. Please let's welcome Her Excellency, Mrs. Emine Erdogan, who will address us. You can use your headsets on Channel 1 for translation. Channel 2, okay. All right.
Nijerya First Lady'si kıymetli dostum Oluremi, First Lady'ler, değerli bakanlar ve ülke temsilcileri, kıymetli kardeşlerim, hepinizi en kalbi duygularla, muhabbetle selamlıyorum. Esselamu Aleyküm ve Rahmetullahu ve Berekatuhu. Sizlere Türk halkının en içten sevgilerini getirdim. Afrika'nın doğal güzellikleri, kültürel çeşitliliği ve her ülkede karşılaştığım içten misafirperverlik her gelişimde beni derinden etkiliyor. Bugün de bulunmaktan büyük bir mutluluk duyduğum Nijerya'nın başkenti Abuja kentinde dünyanın farklı köşelerinden gelmiş ülke temsilcileri ile bir aradayız. İslam İşbirliği Teşkilatı üyesi Afrika ülkelerinde kanserle mücadelede farkındalığın arttırılması amacı bizi bir araya getirdi. 13. İslam Zirvesi marjında Türkiye'de düzenlediğim ilk oturumun ve yayınladığımız İstanbul Deklarasyonu'nun üzerinden 8 yıl geçti. 2018 yılında Burkina Faso'da ve şimdi de Nijerya'da gerçekleştirilen seminerler seneler önce ektiğimiz tohumların filizlendiğini gösteriyor. Halklarının ve tüm insanlığın sağlığı için böylesi önemli bir temadaki toplantıya öncülük eden Burkina Faso ve Nijerya First Lady'lerini yürekten tebrik ediyorum. Etkinliğin hayırlara vesile olmasını, ülkelerimiz arasında ilim ve şifa köprüleri kurmasını diliyorum. Değerli katılımcılar, Dünya Sağlık Örgütü gelecek 15 yıl içinde 30 milyona yakın insanın kansere yakalanacağını, yarısından fazlasının ise hayatını kaybedeceğini öngörüyor. Günümüzde küresel ölçekte her 6 ölümden birisi kanser yüzünden gerçekleşiyor. Önlenebilir bir hastalığın her eve girmesi ve sevdiklerimizi bizden koparması maalesef yüreğimizi dağlıyor. Bildiğiniz üzere kanser vakalarının %90'ı çevresel faktörlerden kaynaklanıyor. Hastalıktan önce ona sebebiyet veren çevresel faktörleri, yani yaşadığımız çevrenin değişen kimyasını konuşmamız gerekiyor. Birçok meselemizin temelinde insanı ruh ve beden olarak parçalayan ve doğadan uzaklaştıran modern görüş yatıyor. Bugün Afrika'da kanser kaynaklı ölümler, AIDS, tüberküloz, sıtma gibi bulaşıcı hastalıkların toplamından daha fazla can kaybına neden oluyor. Bu tablo karşısında tüm Afrikalı kardeşlerim adına soruyorum. Daha önce kıtada çok ender görülen kanser vakaları neden böylesine arttı? Cevap, ülkemizi ürkütecek kadar yalın, Afrikalıyı koruyan yerel yaşam tarzı ve beslenme alışkanlıklarıyla birlikte sağlık hali de kayboldu. Ne yazık ki bu çağın bize aşıladığı tüketim kültürü sebebiyle binlerce yıldır nesilden nesile aktarılan kadim yaşam öğretilerine sırtımızı döndük. Oysa Asya'da, Anadolu'da ve Afrika'da şifayı hayatın merkezine alan bir hayat tarzı hakimdi. Bir zamanlar kervanlarla kültürlerin yanı sıra salgın hastalıkların da taşındığı ticaret yolları üzerindeki Anadolu'nun şifahanelerinde ilaçlar kişinin mizacına göre üretilirdi. Reçeteler müzik ve koku terapileriyle birlikte uygulanır, ruh özgürleştikçe beden hastalıkların esaretinden kurtulurdu. Yemek, içmek sadece biyolojik bir faaliyet olarak görülmez, ruha ve bedene şifa olarak değerlendirilirdi. Geleneksel öğretilerimiz sağlık ile doğal yaşam bağlantısını vurgularken, dinimiz helal ve temiz gıdayı emrederken, Hazreti Peygamberimiz sallallahu aleyhi ve sellem nesillerin yiyip içtiklerimizden hasıl olacağını söylerken, evimizi ve soframızı işgal eden kimyasallar ile mücadele etmekten bizi ne alıkoyuyor? Üstelik gıda sektöründeki bu zehirli dönüşüm artık topraktan ekilen tohumdan başlıyor. Küresel gıda sistemleri artan nüfusu doyurabilmek için GDO'ya mecbur olduğumuzu ileri sürerek kanserojen olabilecek yapay ürünleri dayatıyor. Oysa hepimiz tarladan sofraya varıncaya dek heba edilen ürünlerin yalnızca 1/3 ile küresel açlığın engelleneceğini biliyoruz. Doğal ve helal olanı yeryüzünde hakim kıldığımız tabiat ile aramıza ördüğümüz yapay duvarları yıktığımız oranda gelecek nesillere önlenebilir hastalıklardan arındırılmış, yaşanabilir bir dünya bırakacağımıza inanıyorum. Kıymetli misafirler, Türkiye olarak kanserle mücadele konusunda gerek hastalığın tedavisinde, gerekse önlenmesinde etkili adımlar atıyoruz. Bu mücadeleye hiçbir vatandaşımızın çaresiz hissetmemesi için sağlık altyapımızı herkes için erişebilir olacak şekilde güçlendirerek başladık. Türkiye koğuş sistemi yerine her hastaya oda tahsis edilen şehir hastaneleriyle, her semtteki aile hekimlikleriyle uluslararası kabul görmüş tanı ve tedavilere ücretsiz erişimde sağlık sisteminde adeta çağ atlamıştır. Bu sayede pandemi döneminde dahi kapasite sorunu hiç yaşamadık. İnsan hayatının kutsallığına yürekten inanan, hastalara sevgi, saygı ve şefkatle yaklaşan sağlık ordumuz sayesinde yüzümüzü güldüren sonuçlar alıyoruz. Öte yandan kanser başta olmak üzere birçok kronik hastalığın sebebi olan kimyasal düzeni doğal olan ile değiştirmeye çalışıyoruz. Himayemde başlattığımız Mirasımız Ata Tohumu projesi ile ülkemizdeki yerel türleri kayıt altına alıyor, yüksek teknoloji içeren gen bankalarını da koruyor, toprakla buluşturup çoğaltarak vatandaşlarımıza ulaştırıyoruz. Yine himayemde başlattığımız sıfır atık projesi kapsamında organik atıklardan kompost yapımını teşvik ediyor, toprağımızı ve bedenimizi kimyasal gübrelerden korumayı hedefliyoruz. Başkanlığını yürüttüğüm Birleşmiş Milletler Sıfır Atık Danışma Kurulu bünyesinde dünyadaki iyi sıfır atık uygulamalarını araştırıyor ve yaygınlaştırmak için çalışıyoruz. Bu süreçte Türkiye bilgi ve deneyimini paylaşmanın yanı sıra milli gelirine kıyasla dünyanın en cömert ülkesi olmayı ve dayanışmayı sürdürüyor. Beraberinde obeziteyi azaltarak, fiziksel aktivitelerini artırarak gençliğimizi her türlü bağımlılıktan kurtaracak etkinlikleri çok önemsiyoruz. 2009 yılında yürürlüğe giren kapalı alanlarda sigara içme yasağına elektronik sigaraları da ekleyen Türkiye bugün dumansız hava sahasına sahiptir. Tam bağımsızlığa giden yolun zihni berrak, bedeni sağlıklı, vatansever, merhametli ve iyi eğitimli gençler yetiştirebilmekten geçtiğine inanıyorum. Bu nedenle yurt içinde ve yurt dışında yürüttüğü faaliyetlerle her türlü bağımlılıkla mücadele eden Yeşilay camiamızı özgürlük savaşçıları olarak görüyor ve tüm kalbimle destekliyorum. Kıymetli konuklar, kansere bağlı ölümlerin %70'i ne yazık ki imkanları kısıtlı olan az gelişmiş ülkelerde yaşanıyor. Afrika ülkelerinin yine küresel bir sorunun meydana gelmesinde payı olmadığı halde sonuçlarından orantısız biçimde etkilendiğini görüyoruz. Kıta ülkelerinin de kanserle mücadele alanında teşhis, takip ve tedavide dünyanın geri kalanının sahip olduğu imkanlara erişebilmesi gerekiyor. Bu konuda uluslararası örgütler kadar, hatta daha fazla İslam İşbirliği Teşkilatı'nın sorumluluk üstlenmesinin, komşuluğun, kardeşliğin ve ümmet bilincinin bir gereği olduğunu düşünüyorum. Tıbb-ı Nebevi'nin hikmet reçetelerini insanlığın hizmetine sunma konusunda da tarihi bir misyonumuz olduğu kanaatindeyim. Peygamber Efendimizin bütüncül sağlık yaklaşımını yeniden benimsediğimizde yitirdiğimiz şifayı bulacağımıza tüm kalbimle inanıyorum. Türkiye'de kadim tıp bilgeliği ile Batı'nın teşhis ve tedavi olanaklarını entegre edecek çalışmalar yürütüyoruz. Yüzyılların deneyimini günümüze aktarmak için arşivlerimizdeki nadide el yazması tıp yapacaktır. Kardeşlerimiz ile birikimlerimizi paylaşmaya, her türlü işbirliğine ve desteğe açık olduğumuzu vurgulamak isterim. Filistin halkına soykırım uygulayan ırkçı ve siyonist anlayışın insanlığın kanseri olduğunu ifade etmek istiyorum. ...7 Ekim'den bu yana şiddetine giderek arttıran ve masum insanları katleden işgali lanetliyor, dini, milliyeti, rengi ne olursa olsun her insanın barış içinde yaşayabildiği müreffeh bir dünya diliyorum. Zirvenin Afrika başta olmak üzere tüm insanlığa faydalı olmasını, sağlıklı ve güçlü bir ümmetin inşasına hizmet etmesini temenni ediyorum. Böylesi önemli bir zirvede gösterdiği küresel liderlik ve ev sahipliği için Nijerya First Lady'si dostum Olureme'ye bir kez daha en içten şükranlarımı sunuyorum. İslam İşbirliği Teşkilatı ve Nijerya başta olmak üzere organizasyonda emeği geçen herkese teşekkürlerimi sunuyorum. Kalın sağlıcakla.
We thank Her Excellency for that profound statement. We thank her for sharing experiences and also speaking to the need to also look inwards and some of the very profound things and measures that she has articulated in her paper. Once again, Your Excellency, thank you very, very much. At this point, we're getting ready for the remarks by the Speaker, House of Representatives, Right Honorable Tajuddin Abbas. While we get that ready, just like to share with you, maybe we'll take a quick census. Who in this room does not know about cancer? Who in this room is not either affected in terms of the donation you have to make when cancer is diagnosed to a family member? I'd like to say that is our collective responsibility. If you've lost a friend, a sister, a brother, a daughter, a cousin to cancer, you know that it is quite a heavy loss. By show of hand, okay. By show of hand, because we have to go, we'll take this census later. I was waiting for that. On our behalf, Your Excellencies all, very distinguished ladies and gentlemen, to invite the Speaker of the House of Representatives, Right Honorable Tajuddin Abbas, to address us. The Speaker.
Your Excellency, the mother of our country, Senator Oluremi Tinubu, and the First Lady of the Federal Republic of Nigeria, and National Chairperson, Renewed Hope Initiative. Your Excellency, Mrs. Enin Erdogan, the First Lady of the Federal Republic of Turkey, other First Ladies here present, specifically recognizing the First Lady of Sierra Leone, Gambia, and the representative of Ugandan First Lady. Honorable members and your families here, Your Excellency Barrister Ezenwo Nyesunwike, the Honorable Minister of the Federal Capital Territory, Honorable Dr. Tunji Alausa, my dear brother, the Honorable Minister of State for Health and Social Welfare, His Excellency, Hussein Ibrahim Taha, the Secretary General, Organization of Islamic Countries, ably represented here, other very highly respected guests here, distinguished ladies and gentlemen, a very good afternoon to all of you. I'm deeply honored to extend my heartfelt greetings and present a goodwill message at this significant seminar for the First Ladies from member countries of the Africa Group of the Organization of Islamic Cooperation. This gathering focuses on the crucial issue of cancer, stand as a testament to the collective commitment of our nations to combat this devastating disease. I commend our esteemed First Lady of Nigeria, Her Excellency Senator Oluremi Tinubu, for convening and hosting this important seminar. Your tireless effort, ma'am, and unwavering dedication to the health and well-being of our citizens, particularly the vulnerable, are truly commendable. By uniting the First Ladies of OIC member countries, you have created a platform for collaboration, knowledge sharing, and strategic action against cancer. Distinguished ladies and gentlemen, cancer remains one of our most formidable health challenges, particularly in Africa. Limited healthcare infrastructure, a shortage of medical professionals, and insufficient diagnostic and treatment facilities contribute to late diagnosis and inadequate care. Financial barriers, such as the high cost of treatment and lack of health insurance, exacerbate the situation, leaving many unable to afford necessary care. Additionally, low awareness and educational gaps about cancer prevention and early detection further hinder timely intervention. The combination of these factors results in high mortality rates and diminished quality of life, underscoring the urgent need for comprehensive strategies to address cancer. The Nigerian government has made several efforts to combat cancer and alleviate the challenges faced by individuals living with the disease. These include the Act establishing the National Institute for Cancer Research and Treatment, NICRAT, the National Strategic Cancer Control Plan of 2023 to 2027, increased funding for cancer treatment centers, greater public awareness, and partnership with international organizations. Despite these measures, significant gaps remain, particularly in reaching the poorest and most vulnerable populations, highlighting the ongoing need for sustained investment and comprehensive policy implementation. As representatives of the people, we in the House of Representatives, and by extension, the National Assembly, recognize our role in the fight against cancer. The House will work with the First Lady, Her Excellency Senator Oluremi Tinubu, to enact a National Cancer Act to reduce cancer mortality through comprehensive measures, including the promotion of cancer screening, early diagnosis, treatment advancements, and palliative care. It will also guarantee greater investment in cancer care infrastructure and provide a framework for establishing and strengthening comprehensive cancer treatment centers across the country. A critical aspect of the proposed legislation will be a cancer drugs fund to ensure that more patients benefit from cutting-edge treatments. Distinguished ladies and gentlemen, in conclusion, I once again applaud the First Ladies for their exemplary leadership and dedication to this noble cause. Your influence and advocacy are powerful catalysts for change. May this seminar inspire innovative solutions, strengthen partnerships, and renew our commitment to eradicating cancer forever. Thank you. May God bless the Federal Republic of Nigeria. May God bless us all. Thank you.
She is compassionate. Her commitment to public service extends beyond politics, as she has made significant contributions as an educationist, administrator, and philanthropist. She serves within the limits and above the limits as chief advocate to control and contain the spread of disease, particularly those who are preventable, and those also that seek for cure and treatment. On behalf of all of us, all women here, I'd like to invite Her Excellency Senator Oluremi Tinubu, CON, First Lady of the Federal Republic of Nigeria and National Chairman, Renewed Hope Initiative. Her Excellency.
We be seated. Thank you very much. First Ladies of various countries present, particularly the First Lady of the Republic of Turkey, Her Excellency Emine Dogan, the First Lady of the Republic of Sierra Leone, Her Excellency Fatima Madabio, First Lady of the Republic of the Gambia, Her Excellency Fatoumata Barbaro, representative of the First Lady of the Islamic Republic of Mauritania, representative of the First Lady of Uganda, and I believe Mozambique will be joining us for dinner because we've had quite a long week. The Honorable Speaker of the House of Representatives and his lovely wife, Right Honorable Dr. Tajuddin Abbas, I want to particularly thank you because I didn't talk to you until yesterday. Thank you so much. And other members of the House of Representatives here present.
wives of members of the National Assembly members that are here, wives of the state governors and first ladies of the various states present, honorable ministers, particularly the Honorable Minister of Health and Social Welfare for State, Dr. Tunji Alausa, Honorable Minister of the Federal Capital Territory, host city, wives of honorable members here present, wives of service chiefs, Secretary General of the Organization of Islamic Communities, represented by His Excellency Dr. Ahmad Sengedo, members of the diplomatic community, heads of government agencies and parastatals, development partners, WHO, IAEA, ISDB, NGOs and CBOs here present, Your Highnesses, members of the press, distinguished delegates from the OIC member states, ladies and gentlemen, I am most delighted to address you all at the opening ceremony of the Organization of the Islamic Cooperation, OIC, on promoting cancer awareness and advocacy programs in the OIC African member states. I am honored to host the third edition of the high-level regional seminar with the theme, Innovative Approaches to Cancer and Early Detection. This event is intended to provide global experts and the First Ladies of the OIC African member states with the opportunity to discuss and make recommendations on the initiatives to promote effective cancer control and prevention in the African sub-region. The third edition of the OIC High-Level Regional Seminar is timely, as it coincides with the period when we are planning to commemorate the first anniversary of the administration of His Excellency President Bola Ahmed Tinubu, GCFR, who within 11 months of assumption of office as President and Commander-in-Chief of the Armed Forces in Nigeria has made tremendous impact in the fight against cancer in Nigeria. Sequel to the brief of Mr. President by the Coordinating Minister of Health and Social Welfare and his team, immediately approved the expansion of access to cancer treatment and care, in particular by upgrading 6 federal tertiary health institutions with modern brachytherapy and nuclear medicine equipment and other ancillary and complementary facilities. Due to President Bola Ahmed Tinubu GCFR's commitment to addressing cancer care in Nigeria, he ensured that the health sector was allocated more funds in the 2024 budget. While Mr. President has fully taken the diagnostic and treatment component of cancer care, I am leading the advocacy to promote innovative approaches to cancer prevention and early detection. This is based on my belief in saying that prevention is better and cheaper than cure. Some studies in Nigeria have reported that as high as 60 to 80% of cancer patients in Nigeria present to health facilities at stage 3 or 4, which makes treatment outcomes very poor. My major interest is to reduce the prevalence of late presentation and in order to improve treatment outcomes. Report from various cancer registries in the country, which have been corroborated by Globocon data reports, showed that there were 127,763 new cancer cases and 79,542 deaths within the year, and also the prevalent cases of cancer over a period of 5 years in the country stood at 269,109. Globocon shows that cervical cancer is the second commonest cancer among women in Nigeria. Fortunately, it is preventable and curable when detected early. This has led to my stand in championing preventive measures and early detection approach to all preventable and curable cancers in Nigeria. It was on this premise that I launched the introduction of human papilloma virus vaccine for the prevention of cervical cancer in Nigeria on the 24th October 2023. This marked the beginning of the inclusion of HPV vaccine into the routine immunization by the National Primary Health Care Development Agency. I am aware that over 9 million girls have been fully immunized since the launch. I want to use this opportunity to reassure Nigerians that cancer is safe, the vaccine is safe and very helpful to prevent cancer of the cervix in our young girls. I want to commend the efforts of different ministries, departments and agencies of government, bilateral and multilateral agencies, as well as non-governmental organizations and stakeholders that have contributed in the fight against cancer in Nigeria. My office will continue to partner with all stakeholders to address the challenges of late presentation of cancer cases to health facilities across the country. We will leverage on the existing health infrastructure and other stakeholders, including local and international non-governmental organizations, to reverse the trend of cancer incidence in Nigeria. At this juncture, I will want to thank the First Lady of Turkey for being the first to host the First Ladies of OIC member states back at OIC Summit in 2016. I am grateful for her meeting despite the short notice during my visit to Turkey on official assignment. And I particularly want to thank you so much for the experience and for the love for our continent. You showed this by describing in your book that Africa is the rising sun. I want to thank you, we love you, even for having an African center in Ankara. I'm here to visit. You came in here reminding us that our food, our dietary and environmental factors are very, very crucial in the fight against cancer, and that we should go in and to learn from our Asian culture of Asia, Anatolia experience and Africa experience. We know we are gifted with plants, and you brought it to me when I was defending my thesis on some medicinal plants in Nigeria. I studied 10 plants intensively. I studied education biology, but I worked on 10 plants. And now that we've introduced every home a garden, I think for the winner, you should have a medicinal plant in your garden. I've decided to plant, while you were speaking, I told my staff, I said, I'm planting bitter leaf. Bitter leaf is very medicinal, lemongrass, saint leaves, and also water leaf. They are very, very medicinal, and I know the doctors can attest to that. Thank you so much for your visit. I am also delighted to welcome my sisters. They've been such wonderful support for me. I will start with Madam Barbaro, because she was here with us during our inauguration, both him and Mr. President, convey our love to him. And my sister, Sierra Leone, very young and feisty. She reminds me when I was young. So every time I will remind her, take it easy, take it easy, and I love you, and thank you so much. I am glad all of you have shared different testimonies about the achievements of your countries in the fight against cancer. However, we all know that the story of late presentation, poor access to quality cancer care is similar across the entire African continent. Therefore, this seminar afforded us the opportunity to learn from each other and understudy the advocacy programs in the region, especially among the OIC African member states. I want to commend the invited guests and indeed all participants at this high-level regional seminar who have been here since yesterday. I am optimistic that you've had fruitful deliberations and discussions. We shall await the recommendations which will be part of the resolutions of the seminar that will be communicated to the OIC African member states for consideration and implementation to address cancer prevention and early detection in our region. Your Excellencies, ladies and gentlemen, I wish to invite you to join me as we support the administration of His Excellency President Bola Ahmed Tinubu CFR to continue to steer the ship of Nigeria to ensure a cancer-free society. God bless the Federal Republic of Nigeria, God bless the OIC African member state, and God bless the continent of Africa. I believe we have worked so hard already. The technical team did quite wonderful, and I think we have a declaration just within the twinkle of an eye. So I'm going to read our declaration, and we will work more on it. And so I have the Abuja Center Declaration of the First Ladies of the Organization of Islamic Cooperation, African Member State, on promoting cancer awareness advocacy programs, because most of our technical teams have been with them since yesterday. So I read, we, the African First Ladies of the Organization of Islamic Cooperation, African Member States, health professionals, scientists, advocates against cancer and other relevant stakeholders came together during the high-level regional seminar on promoting cancer awareness and advocacy programs, which held on the 15th to 16th May 2024 in Abuja, Nigeria, to raise awareness on cancer prevention and control and its prioritization at national and regional levels. 1. Recalling the Ouagadougou Declaration issued by the Special Session of First Ladies Leadership in Cancer Control in OIC member states, which held on 1st to 2nd August 2018, acknowledging that cancer is preventable and treatable disease which poses major challenge and threats to the social and economic development of our countries. Recognizing that cancer deaths in Africa are expected to exceed the global average by 30% in 2030, and that it poses enormous emotional, spiritual, social, and economic challenges on the patients and their families with intergenerational consequences. Further recalling the resolutions and decisions adopted by successive sessions of the Islamic Conference Health Ministers, including resolution number 28 ICHM on healthy lifestyle, prevention and control of communicable and non-communicable diseases, and the health emergencies and disasters adopted by the 8th session of ICHM held in Abu Dhabi, United Arab Emirates on the 15th to 17th December 2019, which emphasized that a comprehensive approach is essential to fight cancer effectively. Recognizing the significant role of multi-sectoral partnerships between governmental agencies, intergovernmental organizations, civil society, and private sector. Reflecting on the Sustainable Development Goals, the SDGs, and reflecting on the NCD Roadmap 2023 to 2030 for the Global Action Plan on Prevention and Control, NCDs 2013 to 2030 to accelerate national responses based on the understanding of NCDs, epidemiology and risk actions, and identify barriers, enablers in countries. Recognizing that the Further, recognizes that tobacco use is one of the most important risk factors for cancer, causing around 20% of global cancer deaths and around 70% of global lung cancer deaths. Acknowledging that the breast and cervical cancer are the two common cancers, known interventions to prevent cancer. For careful planning and priorities to undertake effective activities to reduce the cancer burden. Recognizing the importance of sustainable financing for cancer prevention, control, and palliative care programs in OIC member states, especially the African region. Also appreciating the various initiatives undertaken by countries and various initiatives undertaken by OIC and its institutions and partners, including the prospect offered by the partnership between the OIC, ISDB, Islamic Development Bank, WHO, and IAEA, and other international and national organizations. Also commending the leadership of the First Lady of the Federal Republic of Nigeria, that's me, Her Excellency Senator Oluremi Tinubu, CON, for hosting this event, and affirming our determination to play a role in a multi-stakeholder approach in cancer prevention and control. Having listened to the various presentations, we undertake to encourage and actively participate in promoting cancer awareness advocacy programs as well as resource mobilization in our respective countries. We also pledge to advocate for the prioritization of cancer prevention and control in health agenda at both national and international level through multi-sectoral approach. We hereby call upon member states, 1, to invest more resources in addressing the risk factor associated with cancer by educating children at school to develop the culture of physical activities, healthy diet, lifestyle, launch public education campaigns about healthy diets, targeting adults, engage with representatives of the food industry to ensure compliance with guidelines on healthy diet and promote physical activities as part of everyday life. 2, encourage the participation of civil society and communities in fostering partnerships for dissemination of accurate information about cancer and provision of services for the prevention and control, treatment and care, including palliative care. 3, integrate cancer prevention into primary health care system and promote greater public awareness about the importance of cancer preventive measures. 4, strengthen implementation of early detection and screening programs for women which focus on breast and cervical cancers, which are the most frequent and detectable cancers. Cervical cancer is even preventable. 5, embrace tobacco-free OIC initiative by participating in the training and capacity building programs to facilitate the development and implementation of sustainable national tobacco control strategies in the OIC member countries in line with the guidelines set by WHO Framework Convention on Tobacco Control, recognizing that tobacco is the main cause of cancer. 6, develop and strengthen population-based cancer registry like is done in the Gambia, and scale up national cancer control program that meet the increasing need for health promotion, prevention, early detection, diagnosis, treatment, palliative care, and rehabilitation to ensure that no one is left behind. 7, promote and coordinate an integrated approach to addressing NCDs through the application of evidence-based high-impact intervention to optimize available resources. 8, share regional best practices and promote regional coordination mechanisms in cancer registration, cancer control planning, referral pathway, and implementation to strengthen health systems. 9, strengthen national capacity for research and development, including research infrastructure, equipment and supplies in research institutions, and the competence of researchers to conduct good quality research. 10, improve access to appropriate technologies with support of relevant partners for the diagnosis and treatment of cancer to promote early diagnosis and treatment. 12, report to Islamic Conference of Health Ministers on the recommendation made to strengthen national health system to ensure sustained delivery of effective cancer control programs, including high-quality cancer registration, which will guide adequate intervention. OIC General Secretariat, relevant OIC institutions and international partners to 1, coordinate with relevant partners to support member states in their efforts to prevent and control cancer and mitigate its impact by providing technical assistance and capacity building for the national health systems. 2, support public awareness events on cancer organized by and under the patronage of respective First Lady of member states to effectively address the cancer menace. 3, strive for strengthening cooperation between OIC member states in line with the prevention and control of diseases thematic area of the OIC Strategic Health Program of Action, SHPA. 4, strengthen the capacity of the Secretariat both to support the implementation of cost-effective intervention and country-adapted models of care and work with international partners to harmonize the technical assistance provided to countries for cancer prevention and control. Finally, work with member states and collaborate with global and regional cancer control organizations such as the Union for International Cancer Control, an African Organization for Research and Training in Cancer, non-governmental organizations, private sector entities, philanthropic foundations, and academic institutions to develop partnerships to scale up cancer prevention and control, and to improve the quality of life of cancer patients in line with Sustainable Development Goal 3 and 17, as well as OIC 2025 Program of Action. Thank you so much for your time and for listening. This is our declaration.
The comprehensive Abuja Declaration on First Lady's leadership on cancer control are spelled out there by the Mother of the Nation, the First Lady of the Federal Republic of Nigeria. I understand that this declaration will be signed, and the Permanent Secretary, Federal Ministry of Health, is getting that in process. The signing of the Abuja Declaration by our First Ladies here present. Her Excellency, the Gambian First Lady, is signing presently. Next is Her Excellency, the First Lady of Turkey. Well, okay. Thank you. The First Lady of Sierra Leone has appended her signature. Now, the turn of the convener of this meeting and the First Lady of the Federal Republic of Nigeria. Thank you very much. I know that we would now please all stand for the national anthem. Can we please all rise? She has not signed. Oh, okay. All right. Okay. This is photo time, photo opportunity time. Can I have all the First Ladies, Your Excellencies, first? Can you make it? Okay. The representative of Mauritania, please come up, and Uganda. Representative of Mauritania and Uganda, please come up. Careful, careful, careful, careful. Okay. Okay. Can I please have the Right Honorable Speaker, the Minister of State, and our partners, OIC, yes, IAEA, WHO, and the Islamic Development Bank. Yes, we. Thank you. Okay. Thank you. All remain standing for the national anthem, please.
Stop happening gently, come on. My club happening gently. No, go back. Fly, my club. I'm gonna leave my club. Be pardon now, gently. Gently.
Honorable Minister. Minister. Thank you. Now we would break for a tour of the exhibition, when our First Lady will be leading other First Ladies to the exhibition stand. Thereafter, there will be tea break. The exhibition would show some of the current situation and care and treatment